series of webinars to address a variety of aging-related topics, all of which will inform and advise the Governor's Master Plan for Aging. Next slide. We are encouraging you to join us every Wednesday, beginning now through the end of April, from 9:30 to 11, until this series of webinars will tackle a different topic each week, ranging from housing, homelessness, transportation, retirement security, and more. We're thrilled to be starting this week with healthy aging. Let me take a minute and talk a little bit more about the webinar Wednesdays. Each one will feature a local leader, a state partner, and a stakeholder advisory committee member, all of whom will present people-centered stories, data-driven information, programs, services, and recommendations. We are trying to keep it simple by having all information at engageca.org, our brand new public-facing website that launched yesterday. No need to register. After we have these webinars, you'll have the slides and the recordings posted there for you to catch up and share with your colleagues. And probably what we're most excited about is we're piloting something new. We are going to try polls and questions and recommendations coming from all of you who are listening in real time so that we can truly engage more and more diverse Californians across the state. This is one of many channels to get information and to advise our administration on the master plan. And we hope this one is valuable to you and to us. And of course, we are always in continuous improvement mode. So this is our first one of a series, and we will no doubt learn lessons and welcome your feedback on how to make each one better than the one before. Again, today we'll be trying polls. We'll be asking for your questions, and we'll be asking for your recommendations. So look forward to getting all of that feedback from you. Next slide. Today's topic is healthy aging, a shared priority and goal for all of us. And we are so delighted to have such an all-star lineup of speakers. For our state partner, we have Amanda Lawrence from our partner agency, the California Department of Public Health. For our local leader, we have Champion Victoria Jump from the Ventura County Area Agency on Aging and part of the board of the State Association of Area Agencies on Aging. And then we have, I can only call him a celebrity, Professor Fernando Torres-Gil from UCLA, who we are honored to have on our Stakeholder Advisory Committee advising the master plan, and has a distinguished and influential career in aging, ranging from Washington to California over decades. And we're so delighted to have him on the committee and him here kicking off the Wednesday webinar. But before we jump in, just want to make sure everybody has our background, and I hope our first set of polls are coming across now. We want to know who's here, who's joined us. So our first couple questions are going to be who's here. So please answer them as they come, and we'll report back shortly. All right, here's your speed course in the Master Plan for Aging. Of course, it began with our governor, Gavin Newsom, who has committed to a California for all in all that he does, and issued an executive order in June calling for a master plan for aging, tasking the Secretary of Health and Human Services, both with a cabinet work group and a stakeholder group, particular focus on long-term care, as well as building an age-friendly California. Why did he do this? Obviously based on the people in his own family and in his own experience, but also the data. Next slide. I think everybody knows California is aging. These wonderful population pyramids show, begin as a Christmas tree, if you will, a pine tree, if you will, with lots of people at the younger ages, and then over time by 2030 begin to look like a pyramid. Excuse me, a column, there's my geometry, a column with more and more people at all ages. So really a changing face of our families and our communities. And next slide, it's not just changing in numbers, it's changing in diversity. As this is a hard slide to read, but thank you to our colleagues at the Department of Finance in showing the growing numbers of Latino and Asian Pacific Island and Native American elders, as well as an African American, all diversifying not just the numbers of people aging, but the families and communities experiencing aging. So in short, what does this mean? Next slide. Aging is changing. More diversity, as we just saw, also more people living alone, more at risk of poverty and homelessness, and more awareness in the popular community, I would say, of the stages of aging, that as more and more of us have decades to live after 50 and 60, that each of those stages provides different opportunities and different challenges. So given that aging is changing, time for a master plan. Next slide. It starts with our vision of a California for all. It means a California for all across the lifespan, and it's grounded in our California for all values. We want all of us to have choices about how we age. Equity is a critical value for our state and ourselves, and making sure all of us have these choices and acknowledge the disparities that often set us up for aging with different challenges and different opportunities. We are acknowledging the importance of dignity and disrupting the age bias, the ableism and discrimination that often isolates and excludes our elders. We want to make sure that we have inclusion and accessibility in this process and in this implementation and in our communities. Always want to innovate. And of course, none of this is about state government or even government doing it all. It absolutely requires partnership among all levels of government, but critically with philanthropy, private sectors, families, and communities statewide. We will take this mission to deliver by October 4 deliverables, a state master plan with our 10-year priorities and goals, a local blueprint that communities across the state can adapt to refine and refresh your own priorities, driven by data dashboard that we're building with our partners at CDPH, again, of state and local data on aging, and best practices resources. So when you do want to do the next step in your community, you've got some places to learn from. Next slide. Overall, we've organized the work, because aging is everything, into 4 buckets just to help us get our arms around this wonderful topic. Services and supports, livable community. So let me take a second on this. Services and supports, we will live where we choose as we age and have the help we and our families need to do so. Goal 2, livable communities and purpose. We all will live in and be engaged in communities that are age-friendly, dementia-friendly, and disability-friendly. Goal 3, health and well-being. We will live in communities and have access to services and care that optimize our health and quality of life. And that's actually where today's topic will start, healthy aging. And goal 4, economic security and safety. We will all have economic security and be safe from abuse, neglect, exploitation, and natural disasters and emergencies throughout our lives. These are the vision, the values, the mission, and the goals that are guiding our work. So with that foundation, we can pivot to healthy aging, but first let's see what we learned about who is here on our call. Adam Willoughby, the Director of Communications and Legislation here at CDA, will tell us what we've learned.
Great, thank you so much, Kim, and thank you for everyone on this Zoom webinar for responding to the 3 polls that we launched. I'm going to briefly share out those results. So the first poll that we launched was, where do you live in California? And so it looks that roughly 34% of the folks on this Zoom webinar are from the Bay Area, 21% are from the Sacramento Valley, 25% are from the Southern Coast, we have 7% from the Central Coast, 4% from Northern Coast, and 6% from Cascade Sierra. So thank you again for responding to that poll. The next poll that I'm going to share out results is, what age group do you belong to? So it looks like roughly 38% of the folks on this Zoom webinar have indicated that they are age 65 or over. Roughly 55, roughly on the call identify as being 45 to 54. Roughly 11% are 35 to 44, and 12% are 25 to 34. Okay, so the third and final poll that we asked if you identify as a professional in the field of aging, or if you are a interested member of the public. And the responses we received, 66% of respondents indicated that they're a professional in the field, and 34% indicated that they are an interested member of the public. So thank you again for responding to those polls. We will be launching additional polls as this webinar continues. We will also be posing a number of questions in the question and answer feature And we would also encourage you as participants to submit questions to us, either using the chat feature or the question and answer feature, and we will pose those questions accordingly. So with that, we are now going to transition to our second presentation, going to be conducted by Victoria Jump with the
First, Amanda Lawrence.
Oh, I'm sorry. My apologies. Amanda Lawrence with the California Department of Public Health, again on the topic of healthy aging in California. So Amanda, you're up.
Hi, hello. Thank you. And we at CDPH are delighted to be a part of this launch of Webinar Wednesdays and a partner in supporting health and well-being of older adults in California. Today I'll be providing a brief overview of aging in California from the view of public health, because public health considers healthy aging from a life course perspective, meaning that aging starts at conception. The public health system on local and state levels approaches protecting the population's health and preventing disease through several means, including, but not limited to, health education and promotion, research, investigations, surveillance, and policy. And knowing that how we age is largely determined by the cumulative impact of environmental exposures as well as lifestyle choices throughout our lives, early and midlife public health interventions are just as important as later life interventions. And we here are expanding our approach to specifically serve older adults. And I'll share some of those examples later in our presentation. So when it comes to life expectancy and older adult health, California is doing quite well compared to other states. But of course, there's room for improvement across several indicators in the health and longevity, and a need to prepare for the growing size of this segment of the population. Last year, the annual America's Health Ranking Senior Report rated California as 7th in the nation for overall adult health. And additionally, California ranks 4th in the nation in terms of life expectancy. So the average Californian is expected to live to 81 years of age, but of course, California is a very large state and life expectancy can vary by location. For example, among people living in the 10 most populous metro regions in California, people in San Jose have the greatest life expectancy of 84 years, and then people in Bakersfield have the shortest life expectancy, which is 78 years. So these disparities in life expectancy can be due or associated with education level, gender, race, ethnicity, and other factors. Next slide. So as indicated in this graph, racial and ethnic gaps persist in average life expectancy. And while the overall average expectancy is around 81 years in California, African American average expectancy is almost 5 years shorter than that, while Asian American life expectancy is almost 7 years higher than average. The intersection of place, including access to employment, education, and other services, discrimination and stress, and genetics can play a role in these disparities. Next slide, please. So the leading causes of death for those over 65 includes heart disease, cancer, Alzheimer's disease, stroke, diabetes, unintentional injury, and influenza and pneumonia. Here at CDPH, we have several programs and initiatives to alleviate the burden and promote prevention of these diseases and those unintentional injuries, and other areas of key concern to older adult well-being. While our department's program, policy, and planning and research efforts target health issues that begin with supporting healthy births and continue through ensuring quality skilled nursing facilities at the end of life, here on this slide, I have highlighted several key areas where CDPH activities promote and support the health of older adults. You may notice I've bolded Alzheimer's and dementia and opioid overdose prevention because I'll go into a bit more detail on those topics later in this presentation. Next slide. So as I mentioned before, there are several factors that contribute to the disparities in life expectancy. And it's often said that one zip code is the greatest predictor of life expectancy, and these differences can be dramatic. Researchers from the New York University School of Medicine recently used data from their City Health dashboard to find that in cities across the US, people can live at least 20 years fewer than those in other neighborhoods in that same city, even if they're just blocks or miles away. And San Francisco is one of these top cities with the greatest life expectancy gap. So the illustration on this slide is what's been coined the social determinants of health. And we use it to guide government agencies and community-based organizations in developing interventions that can disrupt these determinants, largely by building up partnerships across sectors, just like this master plan includes partners from across government agencies and relies on input and partnership from stakeholders across several sectors. CDPH has been consciously moving its approaches in improving population and community health upstream by partnering with other sectors such as education, transportation, and healthcare to improve access to culturally appropriate services, healthy food, and recreational areas so that people can enjoy healthy and more fulfilling lives on personal and social levels, because supportive environments encourage healthier outcomes for all. I do want to highlight just a couple efforts. Please, next slide, please. I'm going to highlight a couple of specific efforts for older adults. And one is prescription opioids. I know we often talk about the rising costs of prescriptions and healthcare, and this intersects with that topic as well as that rising national crisis of opioid overdose and misuse. So about 21.5 million prescriptions were dispensed in California in 2017. And CDPH has been working in collaboration with several agencies and coalitions in tackling this issue. Next slide. So as indicated in this chart, opioid prescriptions increase with age. This dramatic increase begins at around age 55 and becomes dramatically higher at around 85 plus. Next slide. So this graph is a little bit more hopeful because it indicates that we've seen a recent reduction in opioid prescriptions across all age groups. Next slide. So there are some unique risks faced by older adults. So why are they experiencing this higher rate of prescriptions and thus a risk of addiction and overdose? Well, older adults are more likely to experience chronic pain than younger age groups. Therefore, they've been prescribed opioids for longer periods of time to manage this pain. They often are taking multiple prescriptions at once due to multiple conditions or comorbidities, and they're often unaware of which medications are opioids and which are not because they're not familiar with the names of medications. So this all increases the risk of accidental overdose. Additionally, older adults' bodies may metabolize medications differently than younger age groups, and they can feel the effects more strongly. And as indicated on that map on the left there, opioid-related overdose deaths among those 50 to 69 years old varies by county, with the northern rural counties being a particular concern, and that's Inyo County that also has a high crude rate per 100,000. Next slide, please. So CDPH has created a senior-specific campaign to raise awareness of older adult and opioid use. Resources can be found on our website. That link right there on the slide is to this web page. And it guides people through questions that they maybe currently are or should be asking themselves regarding their pain and medications. And I encourage anyone who's concerned for themselves or for a loved one or a patient to visit this website to gather more information about pain management and opioid use. Then in addition to this older adult response campaign, we have several other campaigns and resources to address opioid use in other age groups. Next slide. Okay, so it's no secret that Alzheimer's disease is of significant concern as we grow older, as age is the #1 risk factor for Alzheimer's and dementia. And it's actually now the 3rd leading cause of death in California, recently exceeding the death rate of strokes. Not only does this disease affect that diagnosed individual, but also their family and network, and particularly those who serve as their caregivers. And you can see from this slide the number of hours of unpaid caregiving, and which is a serious burden on those caregivers, their family. It's not just financially, but emotionally stressful, and is a serious public health and healthcare workforce concern. So given California's culturally diverse population, it is imperative that the unique needs and traditions are taken into account when we're designing efforts to address Alzheimer's disease and caregiving, including culturally and linguistic competent diagnostic tools. Next slide. So at CDPH, we have an Alzheimer's disease program, and its mission is to relieve the burden and economic costs associated with Alzheimer's disease and related dementias, as well as to assist in ultimately discovering the cause and treatment of these diseases. Our program administers funding to 10 California Alzheimer's disease centers across the state. These disease centers are all university medical centers, and they provide professional training, diagnostic and treatment services, and community education. We also administer the Alzheimer's Disease Research Fund, which awards research grants to California scientists engaged in the study of Alzheimer's and related dementias. Next slide. Our Alzheimer's disease program was recently selected to participate in the Healthy Brain Initiative Planning Lab. And the lab is a collaboration between the Association of State and Territorial Health Officers, called FOSTO, and the Alzheimer's Association with support from the CDC. So starting last August and going through the end of March this year, the lab will support the Alzheimer's disease program and 7 other state public health teams in the development and strategy and action plans addressing Alzheimer's disease and other dimensions of chronic conditions. So our Healthy Brain Initiative is currently reviewing grant applications from counties across the state to assist in local efforts addressing Alzheimer's disease and related dementias. And we will award a total of $4.5 million over 3 years to fund 6 local health jurisdictions to advance cognitive health as an integral component of public health. And given that Alzheimer's disease also disproportionately impacts Latinos, African Americans, and women, applicants are required to indicate how their proposed work would respond to these health disparities in their communities. Next slide. And finally, given the complexity of promoting and protecting community and population health and that need to address the growing older adult population's health concerns, CDPH has recently launched a Healthy Aging Initiative. And this initiative recognizes that collaboration, not siloed programs and efforts, will have a greater impact on older adult health. So our vision is a public health system that supports healthy, resilient, thriving residents throughout the entirety of their lifespan. And our mission is to amplify, align, and coordinate local and statewide public health efforts to create nurturing, healthy, and inclusive environments for older adults and their support networks. Through a coordinated leadership and a team of representatives from across the department, we're creating a comprehensive public health approach to aging that aligns our resources to increase public health capacity to address these concerns and those of their caregivers. So while this first phase of our initiative has been mainly internal to our department, we will soon be seeking to collaborate with other sectors and local agencies and organizations to identify best strategies for serving California's older adults. And that wraps it up for the Department of Public Health.
Thank you. We are thrilled that the comments and questions and recommendations are starting to roll in. What is the first question we got?
Great, thank you so much. So we received this question from Martha Navarrete. How is the state planning to reach out to Latinos for input on the master plan?
Great question, and this has been the topic at CDA and at our Stakeholder Advisory Committee. We currently have three-part strategy. First, the Stakeholder Advisory Committee was appointed absolutely with diversity and equity in mind, and we do have representatives from that community and for that community at the table. Second, we at CDA have been doing some additional outreach to groups who are not seated at the SAC table, including California Pan-Ethnic Health Network and Latino Coalition for Healthy California, talking to them, I believe this week even, and trying to continue to broaden and deepen. But newest and hot off the presses is our Stakeholder Advisory Committee did recommend that we create an equity work group that would meet 4 times in the next 6 months to inform and advise on deliverables, specifically with that equity lens that is so central. The process to apply to be on the equity work group just got sent to the stakeholders late last week, and I believe a paragraph with how to apply for that will be posted on our agency website very, very soon if it hasn't already. We're looking for 2 more. We have 6 members of our Stakeholder Advisory Committee who have volunteered. We're looking for 2 more members, and then we're looking for 8 people who are not on the Stakeholder Advisory Committee to round us out and having a 16-member advisory committee that would begin meeting in February. So that information should be on the agency, the pre-existing agency webpage. If you're having any trouble finding it or information, as always, please email us at the Engage email so that we can answer that question and connect you to that very, very, very short form. We encourage lots of, I wish we had more than 8 slots, given our state. Well, I know we have so many experts from lived experience and led experience. So please, please do join us in making sure we get this right. I'm also seeing a lot of recommendations come in, which is wonderful. I want to lift up a couple that we're seeing. One from Carmen Bremer, the centrality of physicians in addressing senior opioid addiction. She says they have the most knowledge of how best to ensure patients and families understand risk with medications. Great recommendations about health professions and training. We will take that forward. Another suggestion from Connie about helping seniors set up more different kinds of community living. The example she gives is Golden Girls, which we can, many of us can remember. And so I think there is in our housing, that's a great sneak preview of our housing and homelessness webinar, Wednesday webinar coming on January 29th. That need for community and new and reimagined housing styles and options and meaningful, affordable, accessible choices has come up a lot, and we'll talk more about that then. Thank you for that recommendation. And then a great process question from Deborah Palmer. How will leaders in this master plan collaborate with the governor's state commission on developing a single payer healthcare, healthcare for all? This is a great question. We, as a part of our Health and Human Service Agency, are absolutely coordinating with the other priorities in this area. You may have seen that the Governor's Housing and Homelessness Task Force issued their report on Monday. We are which has many implications for elder housing, including board and care and preventing homelessness and SSI, and we are absolutely coordinating internally and externally to align with those priorities. The same is true with the Governor's Alzheimer's Task Force, which met again yesterday in Southern California to talk about prevention and diagnosis and prevention and treatment, and ultimately, of course, a cure for Alzheimer's and all dementias. We're coordinating closely with them. And so as this new behavioral health task force gets set up, that was just announced in the governor's budget on Friday, the new healthcare for all, and affordability, we will absolutely committed. The wonderful thing about aging is that we are at every table, and our partners in state government have extended that hand of partnership, so we are at every table. I won't say it's easy. There's a lot of wonderful initiatives going forward, and we're relying on all of you to help us make sure those conversations are aligned and coordinated, but that is our commitment to you. Great. Boy, here we go. Okay, great. More questions about the need for recommendations, I would say, more than a question, right? A recommendation that Alzheimer's and dementia organizations, it's critical that there is strong partnership with the LGBT population. How do we make sure that Alzheimer's and dementia groups, as dementia rises, connect with LGBT communities? And we will be featuring the importance of service to and access to the LGBT elders in an upcoming webinar about inclusion. So thank you for raising that. And again, we'll be making sure that that comes forward as a recommendation at the Alzheimer's tables as well as the aging tables. Very deep question. How do we look at strengthening the community-based aging network? And this sentence says, as opposed to delegating to health plans. This is something that our long-term services and supports subcommittee has been working on intently, and will be preparing recommendations on, looking at exactly how do we provide supports to elders in all places, in health plans, community-based networks, and of course, how do we coordinate that care so it's person-centered and focused on quality, value, and outcomes. So these are great to hear, both new themes and themes that we need to elevate and tackle. How are we doing on time? Should we move over or take a few more? Great. More voices for doctor and health professional training in small G geriatrics, if I can borrow a term I just heard at UCSF. So everyone is providing sensitive and accurate care, not stereotypes around aging or stereotypes around dementia. Yes, the issue of caregivers. Appreciate any and all recommendations and support and training for caregivers. Our LTSS committee just did have apologize for the acronym, the Long-Term Service and Support Subcommittee did have a caregiver conversation, I believe January 6th, looking at the paid caregiver force, looking at family caregivers, of course, the backbone for many of us, and looking at assistive technology and the roles of technology in helping with care and supports and services. So that too will become a forthcoming recommendation from that group. Couple operational questions. Is the presentation being recorded? Yes, it will be shared with the slides. Another operational question, the Governor's Commission on Healthy California, all on Jan 27, the room number, all of that information should be on our partner California Health and Human Service website. I can't do a room number off the top of my head, but we can, if you can't find it on the Health and Human Service website or Department of Healthcare Services, absolutely email us and we'll do our best. Let's see, a question about, yes, I'm so glad this question came up. Lorinda Reynolds, thank you for raising it. This is the question about the word healthy. And it's specifically, for years, people in the field of aging have argued about using the terms healthy out of concern for how that term will impact aging with chronic diseases or disabilities, in part due to the effect of an individual's self-efficacy. Is there a messaging strategy on the horizon that will address that concern? That has been brought up in our Stakeholder Advisory Committee, things like successful aging or active aging, and making sure they are fully inclusive for all of us as we age. Including people with disabilities and as you mentioned, chronic diseases. So that's a hot topic. It's still underway. If you have any recommendations, healthy aging is the term that we are currently using and public health is using, but we are welcome all input on how to do that in the most inclusive and clear way possible. And if we could, next question is a great transition. So I think I'm going to let it be our transition to our next speaker. Wonderful, and praise and thank you to Public Health for this concerted effort to focus on aging. It's a wonderful move towards a whole person and a reflection of our demographics. And they're hoping to hear more about falls, which is exactly what our next speaker is going to talk about. So I'm wondering if that is a good transition to introduce our next speaker, Victoria Jump from Ventura County Department of Aging.
Thank you and good morning. Thanks for allowing me the time to talk about falls prevention, which really to me is a critical part of healthy aging. As mentioned earlier, my name is Victoria Jump and I work for the County of Ventura Area Agency on Aging, which is a standalone agency under the county umbrella that provides a full scope of programs and services to older adults, people with disabilities, and caregivers with the intent of, making sure people have options to live in the community and that they age healthy, and really supporting the caregivers as well. My hope is that by highlighting a successful program that works to reduce falls, other counties or people listening in will be inspired to create something similar in their own counties, and that the state will consider including elements into the master plan for aging. Next slide, please. And hopefully everybody is answering the poll question. So the scope of the problem of falls is huge and continues to grow as the number of older adults increases. Each year, more than 1.6 million older adults go to the emergency department for fall-related injuries. Among older adults, falls are the #1 cause of fractures, hospital admissions for trauma, loss of independence, and injury death. Most of us are fallen or know someone that's fallen, and later you'll be able to hear from somebody that has fallen. Next slide, please. The impact of falls-related injuries and death are staggering. Every 15 seconds, an older adult is treated for a fall-related injury. Every 29 minutes, an older adult dies from a fall. Falls are the #1 cause of injury deaths, unintentional injuries, and injury admissions to hospitals in older adults. Next slide, please. In Ventura County, approximately 35,000 falls occurred between 2014 and 2018, and these are for people over the age of 65. 65% of these falls occurred at home, with a balance occurring in skilled nursing facilities or in public locations such as stores, restaurants, parking lots. Most people that fell were injured. Next slide, please. It should come as no surprise that falls are costly. In 2017, California, Medi-Cal paid more than $1 billion in healthcare costs related to non-fatal falls. Nationally, the average hospitalization cost for a fall is between $37,000 and $60,000. The cost of falls nationally continues to increase. You know, just 20 years ago, the cost of falls to the U.S. health system was $19 billion annually. In 2013, it increased to $34 billion, and this year, the Centers for Disease Control and Prevention estimates the cost of falls nationally will be $60 billion. With the aging of the population, this number is only going to increase unless we do something. Next slide, please. So our county hospital system noticed an increase in the number of older adults falling and showing up in the emergency room. And they asked our local emergency medical system, which is housed in public health, to do a heat map of where falls were occurring. So really look at, is it everywhere, is it a problem? So this is what you see as a picture of the county of Ventura, showing the cities and zip codes where the majority of falls are occurring, with the yellow and red being the most, significant areas. And these don't necessarily align with the populations where more people live. They're more geared towards where the age of the population. Next slide. In addition to looking at where people are falling, we started to look into more detail as to why people are falling. So every fall, as you know, is not, caused by the same thing. So we looked at the medical conditions related to why people were falling, such as poor vision, dizziness, polypharmacy issues, mini strokes, dementia, or the use of alcohol and drugs. We also looked at the home as a potential cause for falls, such as improper use of extension cords, wrinkled rugs, clutter, poor lighting, people falling out of bed at night because they're using the restroom and they trip on things. Wet floors around the shower, and small pets that people trip over, and improper footwear such as flip-flops. Next slide. So looking at the cost of the hospital system, where people were falling, and the realization that the number of people falling was increasing each year, the Ventura County Elderly Fall Prevention Coalition was formed, bringing together the medical community, emergency medical service providers, and social service providers. The goal of the coalition is to make an impact on the health and well-being of Ventura County residents, focusing on falls. We really needed a coalition because older adults are a high-risk group. EMS providers have a unique opportunity to assess the patients, identify fall risk, and initiate the prevention process. And also, many falls can be prevented. Next slide. This slide shows some of the coalition partners. As you can see, it's really a broad coalition of hospitals, home health agencies, public agencies, emergency medical service providers, and fire departments. These relationships are critical for the program to work. Next slide. In developing interventions, we wanted to ensure that it was evidence-based and multifaceted. These are just two of the many journal articles and research done showing that evidence-based exercise programs, home modifications, and some type of targeted risk reduction strategies do work. One of the authors of the study above in the Journal of Trauma and Acute Care Surgery is Dr. Thomas Duncan, who is the Trauma Center co-director for the County of Ventura's Medical Center, who also serves as the head of our Elderly Fall Prevention Coalition. Next slide. So in putting together a program, it was done with the goal of reducing the number of preventable falls in Ventura County, focusing on those above the age of 65, raising awareness of fall prevention, and establishing a baseline for falls and demonstrating mitigation. So our efforts at this time are focused on falls that occur in the community. Eventually, the coalition will work on mitigating the falls that occur in skilled nursing facilities. So we are aware that there's a whole population in the skilled facilities that continues to fall. And so we haven't forgotten them. We plan to work on it in the future. We wanted not to just be able to say we were reducing falls, but to be able to show it. So a database was to set up to track every fall that counts, that occurs, sorry. Next slide. Okay, so one of the earlier slides, I showed a map that showed the scope of the problem and where the hotspots are. In looking at the data for who's falling, we also knew that 61% of the fallers were taken to the hospital, 39% declined to go to the hospital, or the call was just deemed to be a lift assist and the person really didn't need to go to the hospital. We also know that 59% of the calls to EMS were for female fallers, with the balance of them being male. The average age for our faller that lives in the community for male and female is 82 years old. So knowing all of this data, where people are falling, why they're falling, a proposal was made to the county of Ventura to fund a pilot study to look at reducing secondary falls in targeted areas. We knew that there were too many falls to be able to take over the whole county at once, so the decision was made to collaborate with 4 of our hospitals: Community Memorial Hospital, Ventura County Medical Center, Santa Paula Hospital, and Ojai Valley Hospital. Next slide, please. So what is our program? So as an older adult falls, they may either call 911 for an ambulance, or many times they'll drive themselves to the hospital. If they call for an ambulance, in the field, our EMS, our emergency medical service providers, do a standardized assessment of the individual, asking an additional set of questions, really to try to determine the cause of the fall. This information is entered into the EMS database, which is called Image Trend. All of our EMS providers and all of the fire departments use this system. Daily, a social worker that works for the Area Agency on Aging gets a report of everyone over the age of 65 that has fallen. So if the individual didn't decide to go via ambulance to the hospital and they drive to the hospital, the emergency department staff can either fill out a form and fax it to our program coordinator, or they can use the link that's been created on their iPads to send a direct referral to the program. The fall prevention social worker that's employed by our agency sends letters to people that have fallen, letting them know about the program and that someone will be contacting them about the program within the next 2 weeks. They follow up and they work with the individual to identify why the fall occurred, really to try to attempt to mitigate future falls. A risk assessment is done over the phone with the social worker. And the social worker will conduct a home visit for those at high risk or those whose homes appear to have contributed to the fall. So the social worker works with the individual and their caregiver many times to arrange for home modifications. They enroll them in evidence-based fall prevention classes. They work with home health agencies if the person has been prescribed home health upon hospital discharge. They work with the public health if a public health nurse is needed, as well as connecting the person to other community resources. And we are fortunate in Ventura County that we do have a robust set of community providers that we work with on a regular basis. Additionally, we work with the Elderly Fall Prevention Coalition to host 2 fall prevention forums a year to educate the public about falls and how to prevent them. And we make sure that one of the 2 is done in Spanish. Next slide. So sadly, not everybody accepts our help. We try, but people still say no. So however, after 5 years of operating this program with thousands of people being tracked, what we do know is that those that have fallen and accept our help have a 5% chance of falling again. Those that say no, they actually have a 22% chance of falling again. Next slide. Okay, so finally, recognizing the need to expand the program to prevent people from falling countywide and not just in specific areas, evidence-based classes were selected to address the different needs and fitness levels of older adults. So an assessment is done for individuals before class enrollment to really ensure that we're putting them into the right class. So currently our suite of classes offered includes Stepping On, Tai Chi, A Matter of Balance, and Walk with Ease. In addition to providing the classes, additional tests are also conducted on all participants, such as a vision test and timed up and go test, which goes into an interactive database where we use analytics to show the effectiveness of each class and the instructors, as well as other data that we collect. So many people want to know, how are we paying for this? Currently, the County of Ventura provides funding for the social worker and staff to recruit and train volunteers and track data. Additional funding is provided through the California Department of Aging and the Older Americans Act, and our local Medi-Cal managed care organization. Public health, through state funding in the past, has helped pay for some of those classes. Funding to be able to provide the data analytics, we have a grant through Alterum, and also we have a company that's called Anacapa Surgical Associates that our Dr. Duncan, who's the head of our fall prevention program, he's the co-owner of it, and he provides funding as well because he so believes in this program. And additionally, we have all of our partners as well that provide their time and expertise to make the program work. So in conclusion, we feel the collaboration between the medical community, EMS providers, and community-based organizations targeting people that have fallen by providing case management, home modifications, and other services, as well as connecting them to evidence-based fall prevention programs, has proven to reduce secondary falls. Expanding the program to prevent primary falls through education and evidence-based classes rounds out our interventions to reduce the amount of preventable falls. So thank you.
So much for that presentation, Victoria. During the presentation, we launched 3 polls, and thank you for the participants for responding to those polls. I'm now going to share out the results of those polls. So the first question that we asked, have you or a family member over the age of 65 fallen in the last 12 months? With 40% of respondents, no, I have not fallen. With 39% of respondents, yes, a family member over age 65 has fallen. And with 20%, yes, I have fallen. So moving on to the next poll question that we asked, of those who have fallen or know someone that has fallen, did you report the fall to your doctor? With 61% of respondents indicating yes, and 39% of respondents indicating no. And the final poll that we asked, which of the following is most important to prevent falls? And with 31% of respondents saying that support for establishing coalitions to bring together social services, medical providers, and EMS public service announcement and outreach. That was the highest response. Number 2 with 26% was exercise programs. Number 3 with 22% was home modifications. Number 4 with 19% was case management for people that have fallen. And finally, number 5 with 2% was hoarding / decluttering programs. So thank you again for everyone that responded to those polls. And thank you, Victoria, for your presentation. We will have additional polls during the next presenter.
Thank you so much for all the questions and recommendations that continue to roll in. Victoria, we do have comments saying, of course, falls are happening at even higher numbers, as you acknowledge, than you report, since so many go unreported or happen without injury. So thank you for addressing this topic that is so important to everyone. The comments reflect that. Couple recommendations. Could you scroll a little bit, please, Nelson, down? We had a great recommendation about making sure that as a public education effort, thank you, Lorinda Reynolds, for your recommendation to make sure that public education is part of this. So as we all age, we understand that, as you, in your words, the aging process and how that impacts our vulnerability with respect to physical injury and the protracted healing process. It helps that if people know, they can help them prevent their own falls. So public education, rather than a fear-based or reactive approach, but a health prevention, could really help address the myths about aging that even underlie ageism. So the importance of public education is one recommendation. Another recommendation from Pat Blasdale: make sure there's adequate access to rehabilitative and therapy services to achieve and maintain maximum health status and independence. Again, in particular for individuals with chronic disease and disability. But again, lifting up, and I just will make a shout out to the Medi-Cal Healthier California for All process. Some of you may have heard of it as CalAIM. Really looking at the broader range of in lieu of services, in addition to medical care, in that broader social determinants of health lens to help all of us age well, age healthy. Judy Thomas suggests the phrase whole person aging. Again, looking at how we talk about this critical piece of aging well. Another suggestion, again, this issue comes up over and over: how do we ensure there are more geriatricians? This question of both recruiting geriatricians throughout the health system and also providing baseline geriatric training to all will be a feature of an upcoming webinar Wednesday about the geriatric workforce. And it has already come up as well in the long-term services and support subcommittee. And I also heard recommendations on it at the Commission on Aging hearing last week. So this topic of geriatrics not being on pace and geriatric training to well serve us as we age is a hot topic, and recommendations welcome on that. Another hot topic has come up of rural communities. Rural communities face unique challenges, often given the distances involved and the dearth of services involved. And we were so fortunate to be hosted for a roundtable on aging in Nevada County, by Nevada County in Nevada City, with City Council Person Jan Arbuckle, one of our commissioners, one of our advisory committee members. And that topic is first and foremost. They will be presenting recommendations and reflections at our next full stakeholder advisory committee meeting on Tuesday. A really wonderful conversation about both the need to make sure services are available and affordable and can meet the needs in diverse communities with distances and other mountain ranges and things to access, but also some creative conversations about how we create attractive, accessible, affordable housing for our rural elder communities that are closer to services, a both and approach. Really, it's been a mark of the process so far, is listening and thinking collaboratively and creatively about all the solutions that might be in the mix. Another suggestion for public education, making sure that folks know how to get up safely if they fall. Excellent. And then some questions about county and city and health and human services and what we call partnership. This is critical. It's wonderful in California that there are so many bright lights of aging programs and disability programs. What the plan is really about is scaling and partnering and serving all of us well. And so one of the questions says, what about the silos between health and local aging? And that happens at the state level as well. And again, I appreciate the questioner calling out that past efforts have not been that successful. It is critical that we learn from what's worked and what's not worked. We are going to be having a webinar Wednesday specifically towards the end about leadership. What does leadership for aging and disability need to look like at the state and in communities? What could we do as the master plan moves from a state plan this October to local plans? How do we make partnership easier? How do we make partnership inevitable? How do we do that? Because certainly we are all administering different funding and have some different rules, but there's more we can do to move our systems to be whole person and coordinated, and that's definitely worth a topic of its own. And just a final note on that, the Long-Term Services and Support Subcommittee also is talking about recommendations that'll be forthcoming around the leadership and coordination of state and local government and healthcare. So hot topic, more to come. Thank you for weighing in on that. Let me just take a second to read more from you. This is wonderful. And then I'm going to hand it over to our Stakeholder Advisory Committee member. Yes, more on county and city partnership and how, you know, again, one other thing I'll say is we at the Department of Aging work very closely with both our AAAs, area agencies on aging, and as well our county social services. Aging programs tend to be at those two places, as well as community partners who are contracted, and of course health plans. So it is very much top of our mind, again, how we can knock down the barriers to partnership, make the local planning process even stronger, even smoother, so that we really are city and county, nonprofit and government, state and county, all moving in the same direction. So welcome models of where it's working, welcome where, you know, places where it's challenging, and that is absolutely part of the plan. Not just what do we want to do, but how do we do it? With that, I believe it is time to hear from our esteemed Stakeholder Advisory Committee member and so much more, Professor Torres-Gil. So I will hand it over.
Thank you very much. It's an honor and exciting to be here, and we commend both the governor and all the other members of the advisory committee. We have a big charge ahead of us, but this is a great opportunity to prepare for the aging of California. So I believe I will, first of all, let me just indicate that we have 34 members on the Stakeholder Advisory Committee, and they represent pretty much all the key professional experts, agencies, organizations, advocacy groups, coalitions, and they represent pretty much all key segments that will be important in bringing together not just coordination, but in implementing whatever comes out of the final recommendations to the governor and the state legislature as well. And I, as one of those 34 members, look forward to both reporting back to the next Stakeholder Advisory Committee meeting on January 21, but also continuing to be an advocate for all persons that are aging and aging with a disability, and certainly to promote the many great ideas that we've come up with here on the Healthy Aging webinar. But let me first shift to, if I may, the public comments. I took time to review the various comments and to integrate them into the presentations that we have here today. And first of all, I want to commend my two colleagues for the two presentations. If we can have that slide, please, where I think the major issue that comes out of the two presentations, which are so important, is that we begin to look at issues of aging, not just what we do or should try to do when we hit whatever elder year we consider, whether it's 50 or 65 or 85, but rather that we look at how we age in terms of our entire lifespan. And the concepts of longevity have been brought out by our two previous speakers. And healthy aging ultimately is most influenced by what we do and don't do when we are younger, whether we're teenagers or we are middle age or we are young old. But there is so much that we can be doing to increase the probabilities, the opportunities for healthy aging. But certainly even at our later years, and I'm 71 years old, there is much we can do even now to practice healthy aging. But hopefully we can begin to broaden the lifespan to start looking at how we can begin to educate others. And here I suggest something that I hope might be taken into account in our advisory committee. Can we consider, for example, a longevity planning campaign for K through 12 students? Can we begin to educate, inform, socialize younger persons, K through 12, and certainly in colleges, to start recognizing that they have the opportunity, as was brought out by our earlier presentations, to live at least to 81. Certainly it varies by gender and ethnicity and race, but all of us can enjoy a longer lifespan. Is there a way to begin to educate and inform younger groups, perhaps a longevity planning campaign, and begin to bring that into their mind, into their thinking? And as Phil Rizzo, an esteemed physician and former dean from Stanford Medical School, laid out best, ultimately, the best prescription for healthy longevity of positive lifestyle behaviors, social engagement, and maintaining a purpose in life. That sums up, I think, very nicely the overall concepts that are important in terms of healthy aging. But in terms of the public comments, let me just bring out a number of points. Clearly, many of the public comments recognize some of the basic elements in practicing healthy aging: exercise and staying active, a good, healthy diet, and certainly maintaining as much as possible emotional and physical health. And let me just add here, I have a physical disability, but even those of us with a physical disability or cognitive or visual or emotional, whatever our conditions might be or chronic conditions, there is still much we can do in terms of practicing healthy and positive lifestyle behaviors, being involved, and having a purpose in life. And those are brought out in the public comments. But there are also some big concerns that we cannot escape or ignore. And certainly, I think the Stakeholder Advisory Committee will be addressing them. The high cost of prescription drugs continues to be the bane for the problem, the concern for all of us. Governor Newsom is certainly beginning to make some important steps in that direction to try to control the increase in the cost of prescription drugs. Many of the comments were concerned about just accessing health and medical care. Certainly, the issues of transportation, living in rural areas, finding a physician that will take your health insurance or Medi-Cal or Medicare is an issue. Many, if not most, worry about finances and retirement insecurity. And very simply, do I have enough money to live a longer life? And certainly those issues are going to be paramount. And then, of course, the issues of housing, the high cost, homelessness. And we know that older adults are now one of the fastest growing group that is facing the fears of homelessness. And of course, what we all now know, loneliness and depression also take away from healthy living. So the public comments brought out much of what we need to incorporate. One of the intriguing comments that came out was a comment referring to getting older and being surprised about the vicissitudes of aging, and especially aging baby boomers may not recognize that certain things happen as we get older, whether it's sciatica or arthritis or different kinds of chronic conditions. So somebody suggested maybe public health can develop a list of common maladies likely to occur in old age. And that is really about becoming aware what happens to us physically and mentally as we get older. And if we know what that might be, perhaps maybe we can begin to prepare for it early on as we go through that lifespan. But moving to the next slide, let me address some of the key concerns that all factor into trying to live a healthier lifestyle. Certainly, as was brought out so in such a compelling manner, and thank you again, Amanda and Public Health, we face economic, ethnic, and racial disparities. Geography and zip codes matter. Certainly, income, race, and immigration status. And the governor, for example, in his proposals, came up with something that I personally feel is very important, proposing that undocumented senior citizens be eligible for Medi-Cal. But California is such a huge disparate state, and there are many factors that impact how long we live and our ability to practice healthy aging. But again, I'm confident that the Stakeholder Advisory Group is taking these into account and is very sensitive. I myself have done much of my research as a professor at UCLA on what it means for California to become a majority minority state, which, by the way, the rest of the country will be majority minority by perhaps as soon as 2042. So once again, California is a trendsetter. But keep in mind, California has many wonderful advantages and lessons to share with the rest of the nation, but we also have many issues, problems, and concerns that we have to show we can address. And I list here the great disparities in income, wealth, housing, retirement, and much of us are well aware of these tremendous disparities and insecurities. And we also have to adjust for regional and local variations. What makes California unique is that it's a nation state. You never have to leave California. Everything's here. It's like traveling the world. But we also have great differences. So if we're going to practice healthy aging, some places are going to be more able to find the resources and supports. Certainly, growing older in Palo Alto and growing older in the great town of Stockton are two different experiences and different abilities to take full advantage of healthy aging. But I think we're well aware of those geographic differences. And then lastly, let me commend the important disciplines that play a big role in healthy aging, as well as falls prevention, which I'll get to in a moment. Certainly rehab professionals, physical and occupational therapists alongside nurses and doctors and social workers are very important in what we do. And the last thing, and I have here on the right side of the screen, the one thing we can all do, as laid out so well by Victoria and Ventura County, is to practice falls prevention. And if I can share my story, I'm kind of an example, a poster boy for falls prevention. Some years back, I fell. I thought I was pretty independent and thought I could just do whatever I wanted to do and not worry about where I was or whether it was safe or unsafe. I fell. I fractured my femur. I was laid up for 6 months with the surgeries and the rehabilitation and the PT and OT, all the things that go into recovering from a fall. And as the director of the Ventura County area agencies laid out so well, a fall is costly. And it took me 6 months out of work to recover. But since then, I have learned my lessons. And thanks through the great service of the USC Falls Prevention Center, headed up by Dr. John Pinus, who have the grant from the administration from community living to promote falls prevention across the country. They sent staff to my home. They did a full assessment of where are the risks, where are the insecurities, where are you likely to slip or lose your balance. Based upon that, they did a full home modification. They also did a physical health assessment in terms of what are my particular risks on falling. And from that, we did things from certainly the grab bars, slip resistant floors, getting rid of throw rugs, making sure that when I take steps up and down that I have something to grab onto. Plus, they showed me how we can all take personal responsibility from that. I began to practice religiously Tai Chi, swimming, Pilates, all to strengthen my core and to achieve greater balance. And also learn the concept of spatial awareness, especially all of us as we get older, and I have a physical disability, just making it a habit that whenever we get off a chair or make a step, we look around to see what is around me that might cause me to trip. Just these basic spatial awareness. So I commend Ventura County for being a model of falls prevention. All of us, no matter how secure or confident we might be about getting around, walking, getting in and out of cars, moving around our homes. All of us are at risk, and I'm happy to say that since my last big falls many years ago, I have been falls free, and I hope to stay that way. So it's the one thing we can all do, is to practice falls prevention, and I've listed a couple of things that can go with it. So I want to thank all of you, and certainly for the audience to be with us, and thank you to Kim and the rest for including me on this wonderful webinar.
Thank you. So now with the time remaining, we'd like to be sure we have your recommendations on this topic for healthy aging and your questions. Questions for any of our three panelists, Department of Public Health, Amanda Lawrence, Ventura County, Victoria Jump, or our Professor Torres Gill from our stakeholder, or for myself, please go to your question and answer box. Question and answer box, Q&A might be on your footer, and type any questions or recommendations. Recommendations welcome. While you are thinking about that and typing in your questions to us, we're going to experiment. Thank you for bearing with us on some live polling. Using your chat feature, if you see that in your footer. First question for you. We lifted up, in this presentation, you heard us lift up 3 topics as keys to healthy aging: fall prevention, Alzheimer's and dementia prevention, and opioid overuse and misuse. Are those the right 3? It'd be the first question I would ask you, and in your chat box you can respond yes or no. Would you agree that those are 3 of the priorities for healthy aging? And I'm going to ask you a question next about what we missed, but would you agree that all 3 of those should be prioritized? Go to your chat box and yes and no. And while those chats are going, if my slide could advance to slide 15 for a second for our next. Let's see if we can pull up slide 15 for our next question. Thank you, so many votes are flying in. This is wonderful. Great voter participation here. Okay, and then the second question I'm going to ask you for your chat, we've gotten dozens and dozens have responded to that. I'd say the majority, but not unanimity, is yes. So that's, but we'll count it for sure. I'm not, that's my quick eyeball count as all these yeses and nos fly by. Let me try my second live poll question. Looking at this list that our partners, the Department of Public Health, identified as other topics that are key to healthy aging with a prevention lens and a public health lens, which would you add as priorities? You see there influenza, nutrition, colon cancer, stroke and CVD, diabetes, healthcare quality, injury prevention and traffic, gambling disorder, violence prevention initiative, emergency preparedness, oral health, climate change vulnerability, and grandparents as caregivers. Which of those would you lift up? Give you a minute to have those roll in. So on the first question, 23 people said yes, those 3 are all priorities. 6 said no. Appreciate that perspective. That's great. About 4 to 1, yes to no. And then on what else should be lifted up on scanning, lots of emergency preparedness, understandable given the recent wildfire and power shutoff, nutrition. Dental has come up a number of times, and people commenting. Yes, and lots of comments on social connection, integration, inclusion. Excellent, excellent. Climate change, couple comments. Very helpful. We do have specific webinar Wednesdays coming up on emergency preparedness. We have another one coming up on isolation and inclusion. We'll focus both on ageism and behavioral health. Those will have specific topics coming up. Yes, and continuing on brain health. Great. Very, very helpful. Can we now turn to the Q&A? I see several have come in for myself or for the panelists. Scroll down for all the new ones that have just rolled in. Okay, lots and lots and lots of questions for health, the primary care, geriatrics. How do we have more of our healthcare professionals trained to serve older people? Concept of community health workers is being suggested. How do we work on making sure not only in that, as well as cultural competency, particularly LGBT seniors, making sure that the healthcare is sensitive and appropriate and responsive to the diverse clientele. Excellent. So lots in geriatrics. There's a couple people who are saying, I would like to have more information about the master plan overall, not specifically this content topic. We direct you to our new webpage that's just launched. Always happy to give this reminder that engageca.org is now live. That will give you every information about the master plan process, which I covered very briefly at the beginning of this call. And we welcome comments and more formal recommendations at any time through that website. So happy to provide more about master plan. And if a master plan 101 webinar would be helpful, we'll take that feedback too. But what we're doing with this series is diving into 15 topics that all we want to hear from the community. We want to lift up what's working, and we want to lift up what's underway, and we want to hear from you where the master plan needs to go next. Several people have want to make sure that we are aware of the Village Movement, which we very much are aware. The Village Movement helped host a roundtable in Nevada County, which we spoke about earlier, and also is hosting one in Humboldt County in the spring. We very much recommend to everyone that people become aware of the Village Movement as a resource in some communities where volunteers are activated to help with everything ranging from rides to isolation, connection, to so much more than I can possibly do justice to. So yes, thank you to all the Village Movement participants on this call. Many comments coming in around making sure that the plan and the programs and services also make those connections. For example, hearing loss people with hearing loss are less likely to be diagnosed with dementia. How do we make those connections across systems, make sure that cognitive health and physical health and behavioral health are all better connected, better coordinated? For example, making sure people can get hearing aids is a very specific recommendation. Always lifting up that we're both talking about our low-income elders who are accessing services through Medicaid, and our missing middle who are really suffering with the gaps in Medicare on these kinds of supports and services, making sure we're really truly addressing all Californians. And then I think, unless there are more comments, let's just do a quick scan if we can at the chat. Yes, great continuous improvement. More materials in Spanish. EngageCA.org is coming soon in Spanish and in traditional Chinese. We are very committed to getting better every week, every month in engaging more. We will be doing that. And then a strong a question that's a great segue into wrapping up. And our next one is a question about working. Where are we going to talk about older workers? And the answer is next Wednesday, the same time, same place. Come back for our conversation with our state partner, local leader, and our stakeholder member about all the issues around in older workers, both people who are working longer because they need to afford these longer years, later life, and people who want to for continued purpose. As you see, we are tackling a topic a week going forward through the end of April. Many of the ones that have come up here are listed, and as I said, there's March and April still to come. If you have a request or a suggestion for a topic, if you have a request or a suggestion for a speaker, we would love to have it. I want to thank so much Jennifer Wong, our consultant, and the whole team who is pulling the series together with our stakeholders. We're co-producing. We welcome that feedback. Other than that, I'll do one last plug for our website on the next slide. Again, it just launched yesterday, designed to make it easier to stay informed and to inform us on your priorities. Let us know, and coming soon in multiple languages. And that's where you'll find the slides and links to the slides and the recordings of these and the upcoming, and all updates on where we are with the master plan. Thank you so much for being a part of this, this pilot, this first one, and for our presenters with their expertise and wisdom and partnership, and for all of you for speaking up with your voice and sharing it with us. Look forward to more of these conversations to come.